Hi, my name is Nicole Simpson, and I am here to discuss a gastrointestinal complication called diverticulitis. And before I get into that, I'd like to show some anatomy about the area affected. Okay, so the large bowel is the area that is affected. And here we have the cecum, which is the area. Let's see if you can see that. There we go. The cecum, where the small bowel attaches to the large bowel. And then we have the ascending colon. And then we have the transverse colon. We have the descending colon. Right here is the sigmoid colon. And further down, we've got the rectum. And then here is the anal canal. Now, with the bowel, of course, the tissue area that is the large bowel consists of the mucosa, the submucosa, the muscle layer and outer serosa, and of course, there's blood vessels, feeding blood and nutrients to that area as well. So with diverticulitis, really starts with diverticulosis. And basically that is started with an increased pressure or of constipation or straining on into that sigmoid area and causing damage to the mucosa and the submucosa lining. And when that happens, that creates a herniated area that turns into pouches, and those pouches are called diverticulum. So, diverticulosis are those small pouches of the sigmoid colon area. So, with diverticulitis is the inflammation of the diverticulum. Okay, so signs and symptoms of diverticulitis will include lower abdominal pain, fever, nausea, vomiting, diarrhea, constipation, bleeding may sometimes occur, decreased appetite, and changes in the bowel pattern. Now, just to note, the older population may experience or present differently. So they may be afebrile. They may also just have tenderness in that lower abdominal quadrant, and their WBC, which is their white blood count, will be in range. So, in order to actually diagnose diverticulitis, if there are no symptoms, no chronic or acute behaviors, this is normally found with a colonoscopy, or some people may get a sigmoidoscopy, and they can see the diverticulum there. If the patient presents to an emergency room or doctor's office and they send them for radiological studies, the CT scan is the most non invasive and preferred method to see the bowel and to diagnose diverticulitis. Now, lab work is also something used in conjunction with the radiological studies, such as the CBC, which is where you're going to find that white blood cell count. Also, you're going to need a C reactive protein, and then check an occult stool just to make sure if the stool has blood in it or not. Okay, so for interprofessional care, the nurse will either, if they're at home, if the patient is home or in the hospital, will determine the nursing care. So if the patient is at home, they're not having severe pain and they're able to manage antibiotics, which is one of the treatments. They can go home. The nurse will call and follow up with the patient, making sure they're not having any pain, and then do some follow up lab work to make sure that their white count is coming down. If the patient is in the hospital, of course, then the nurse will have to make sure that they take care of the patient's pain. We want to make sure that they are comfortable, monitor their vital signs, their white blood cell count again. Um, and with this, the treatments would be to give pain medication. So something like morphine, Tylenol, ibuprofen, and Tylenol can also help with fevers if the patient is presenting with that. Um, Antibiotics is also reducing the inflammation, and that's kind of what we want to do, is to shrink the bowel. Also, nothing by mouth is a MPO is a diet option, and this will actually cause a resting period for the bowel, so it's not working so hard. And with that, then IV fluids are very important to stay hydrated and to push along anything left in the bowel that, and help with just lubricating the area as well. And NG tube may also be placed to help with that as well. Surgery is another possible option if the patient is having chronic diverticulitis. There may be bowel resection in their future, unfortunately. So the plan of care, again, you want to just evaluate now after you've given all of the interventions and see how the patient is doing, asking them about their pain, monitoring again the white blood cell count to make sure that the inflammation is going down, and just providing comfort care, changing positions, doing some therapeutic dimming of the lights or music, things like that, just to help them relax and to calm down if they're having some anxiety with the pain. Another thing that is really important is to actually teach the patient about what diverticulitis is, giving them a bit more health literacy so they can understand what's going on with their body. Also, lifestyle changes are a big thing. So you want to make sure that they are having a high fiber diet, they are increasing their fluids, they are also monitoring their weight. And if weight loss needs to happen, that should be something that the patient should consider. Also, things like bending, heavy lifting, those ergonomic patterns should be taught to help reduce any restrictive area to that bowel. Also, tight clothing. Don't want to wear tight clothing. Okay, so that was my report on diverticulitis. I hope I provided you with enough information. Thank you very much. Bye bye.